demandes-là et je sais là, que les médecins faisaient la même chose, le collège des médecins et tout du genre.
Je crois que ces discussions arrivent. Je suis pas au courant des détails à ce moment-ci, mais je sais que c'est le plan pour augmenter les ressources dans le système.
Merci, Mathieu. Dan Arsenault. Dan? Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. I was speaking with the Mayor of Campobello today, and he's wondering what will happen if a resident of Campobello Island calls 811 with symptoms and needs to get tested. Once they explain to border guards they are driving through the U.S. to re-enter Canada to get tested, will they be allowed entry, and will that be left fully in the hands of American border guards?
That's it's a very pertinent question. We've been told by the authorities that residents of Campobello will be allowed to move. Equally, healthcare workers like A and B will be allowed to transport residents from through Maine to our hospitals. So I guess without specifically talking about an 811 call, unless the doctor could add anything to that in particular, I would say that they could be transported through our A and B network and delivered right through into New Brunswick.
Vicky, thank you. Do you have a follow-up?
Yes, this question is also for the Premier. The town of St. Andrews informed me that they've been notified that if community clusters of positive patients start to occur that are not related to travel, at that point the Public Health Agency has the right to inform towns that they do have a cluster. Will this be the case if we do get to that advanced state of emergency?
So could I just get clarification on that question again?
Sure. The town of St. Andrews informed me that they've been notified that if we do get community clusters of positive patients in towns that start to occur that are not related to travel, then at that point the Public Health Agency has the right to inform towns that they have clusters. Is that going to be the case if we get to that advanced state of emergency?
Dr. Russell?
Well, I'll definitely take that under advisement because our plan is to inform if we do have a case of community transmission, we would be informing the public right away. And at the local level, the regional offices are where the outbreak management is taking place. So I'll keep that in mind in terms of as we move forward.
Thank you, Vicky. Adam Bowie, Brunswick News.
Hey, for Dr. Russell, what, if anything, does 2 days in a row with no new cases mean?
So in an outbreak situation such as this one, and because we expect travel-related cases to continue to pop up, 2 days in a row, it doesn't mean a whole lot other than the test results came back negative. It doesn't mean that lots of tests aren't still being done. I think we're up to over 500. And so we have 11 cases at the moment. I do expect there to be new cases, again, as new travelers come into the province over the next several weeks. And so 2 days in a row, it just means that the test came back negative for the ones that have been tested.
Adam, do you have a follow-up?
I do, Bruce. I was wondering if maybe either the Premier or Dr. Russell could talk about what schools are being, what kind of preparations are happening at school, what kind of use could they be used for possibly if needed?
At this point in time, our focus is ensuring that our facilities, our current healthcare facilities, be designated and be identified to respond as quickly as possible. And that's why we're making some changes with the long-term care patients to give greater capacity in our existing hospitals. Obviously, if the schools are vacant and there are buildings that we need for centers of any kind, they could be used. But at this stage, it's focusing on our current health system and exactly how do we make it more available for any sort of wave that comes through here and be able to respond very quickly.
Thank you. Thank you, Adam. Andrew Waugh, Brunswick News.
Dr. Russell, I'd like to understand how the capacity of the system is faring so far, and at what point is it possibly going to become overloaded? I mean, Dominic Carty's out there tweeting about schools being prepped for other uses. the Premier is suggesting that, you know, obviously these could become overflow facilities. So clearly you're preparing for the system to be overloaded. You know, do you have any projections on when you think that's going to happen?
Well, it is difficult to predict. It is a very good question, and I guess we do have to be prepared for that eventuality. Delaying it as long as possible is our goal because we want everybody to be doing their part and we want everybody to be following social distancing and hand washing, et cetera. So all the measures that are in place right now are really designed to delay the system becoming overwhelmed as much as possible.
Andrew, do you have a follow-up?
Yeah, we spoke to Horizon this morning, and you know, we're trying to get total numbers of ventilators for the whole province. Now, Horizon told us they've got about 95. The Talatay hasn't answered. Can you give us a firm number of how many ventilators there are for the entire province, please?
I have been told that we have 161 and we've ordered 50% more.
So, okay, fantastic. Thank you.
John Morris, did you have a question?
Negative, thank you.
Okay. Thank you, Premier Higgs and Dr. Russell. This now concludes today's briefing. Merci, Monsieur le Premier ministre et Dr. Russell. Ceci met fin à la séance d'aujourd'hui. Merci.
Busy.